Patients with ankylosing spondylitis can have a variety of complications related to the disease. It takes a toll, which usually is back pain, that can become very severe. Ankylosing spondylitis can affect the joints of the spine and the pelvis, where the spine meets the iliac bones, but it can also affect the hips and the knees and other smaller joints. Early on in ankylosing spondylitis, you might have symptoms like joint pain and stiffness. As the disease progresses, the pain can become more chronic, can become more persistent, and can become more severe. Things can get to a point where pain starts to recede and the joints start to ossify or calcify and fuse together. At the very end of the disease, you can have very little joint pain, but now you have a joint that doesn't move anymore. So in the case of the spine, you don't want to fuse in a position where you're crooked. Chronic manifestations of the disease involve fusion of the spine. The other problem that patients with ankylosing spondylitis can develop is that their neck can fuse in a forward posture as well. And that can cause challenges with people being able to look forward, being able to eat their food because their mouth is positioned in a downward position and the food can fall from the mouth. If they're crouched, to compensate for that crouched posture, patients will often bend their hips and flex their knees, and those joints can lock into place in that position as well. If a patient identifies that he has ankylosing spondylitis, that person can meet with a rheumatologist and start on the right kinds of treatments to improve health, improve joint mobility, stretching, exercise, taking medications that will decrease pain and inflammation so they can enjoy all the activities that they want to do, including sports and leisure activities, lead a full life. But also, what it may do is decrease the likelihood that it develops into a chronic condition with permanent joint stiffness and fusion.